Welcome to the program. I'm Lana Kay, and we have a doctor with us today, and she will be helping us with the stress in our lives, how to identify it, and most importantly, what to do about it. Let's welcome Dr. Cynthia Villacis to the show. Welcome, doctor.
Thank you. Thank you for having me.
Okay, doctor, it's so good to be with you. And I know that you're with Healthcare Connections Direct Primary Care. That's a mouthful. I want you to tell us about your practice, how long you've been practicing, and tell us about direct primary care.
Okay, great. Well, I've been at Health Connections Direct Primary Care for about a year and a half ago. I opened it up myself. It's an independent direct primary care group in Crespi Hills, Kentucky. And I opened it to try to fix a number of things that I saw that were wrong as far as with healthcare. You know how when you go to the doctors and first you call to get an appointment, right?
True.
And they're like, well, okay, they can see you 2 weeks from now on a Tuesday at 3. Well, you wanted to get in tomorrow at 9, right?
Right.
So you're like, first of all, you're waiting for your appointment for longer than you wanted. When you get there, you're typically sitting in the waiting room for what?
Sometimes it can be just impossible.
Yeah, sometimes you're sitting there half an hour,
or longer.
Or longer, and then you may be waiting in the room for another 10 or 15 minutes or longer.
Right.
And then you get to talk to the doctor for what, maybe 10 to 15 minutes?
If that.
Maybe. Well, this model fixes that.
Okay.
So it's a membership style medicine. I schedule a half hour for follow-up visits. And I schedule people appropriately so we can actually get to see what's going on with you and figure out how we can help you get healthier as opposed to just kind of getting you in and out and writing a quick prescription.
A quick prescription, go home, see you later. Okay, now, Cynthia, you say, I believe in the mind-body connection, patients' mental and spiritual health as well as their physical health. So it's all connected.
Absolutely.
And so that's your approach. As you talk to them in that half hour, what are you trying to identify?
I am trying to identify where they are with their lives in those different spheres of it and to try and see how they impact each other. Because you very frequently find if somebody is struggling with physical health issues that there are other components of their life that are also struggling.
I see. Okay, I encourage my patients to stay physically active and explore the world around them. And so we know physically active. So explore the world around them. Are you saying do different things, just get outside?
Well, I'd say both. I mean, there are a lot of people that put limitations on what they can do because of self-perceived notions in terms of what they can do in their body. I've been dealing with weight issues for a number of years, but I still try to get out and be as physically active as I can. I go hiking, I go kayaking, I occasionally do yoga. That was a big mental block that I had to get past, and I probably didn't get past it until about 3 years ago when I was at a conference and I saw this yogi who was teaching the class who looked nothing like a yogi what I thought they did. I mean, he was an African-American male, mid-20s, dreadlocks, overweight, and I was like, oh my gosh, if he could do it, why am I limiting myself? I tell myself this all the time, go out and try new things, and so I did, and I've really enjoyed it.
And it's wonderful to have a doctor that's so upfront about, because we all doctors, professional people, everybody struggles.
We're all people.
That's right, we're all people. Okay, doctor, let's talk. Lots of times, doctor, I think people are pretty nonchalant, pretty cavalier about stress. Oh, I'm stressed out, meaning a lot of times they mean I'm busy. But it's more than I'm busy. It's more than that cliche we use, oh, I'm stressed out.
Oh, absolutely.
It can be so tell us, what is stress when we say that? Is it affecting our immune system? It's affecting us. So when we you go for it. You tell us, what is it exactly?
Well, there's busy, and there's busy like happy busy, and you're enjoying what you're doing, and you're just doing lots of stuff, and that's okay. Stress is more of a physiologic reaction when your body feels like pressure, and it's like that fight or flight response. People's heart rate goes up, their cortisol levels increase, their blood pressure increases, may start breathing a little bit faster. And if there's a real threat that's going to attack you, that's a good thing because you want to be able to react quickly and deal with that danger. But if you're having that situation and it's going on for a period of time, those responses are not healthy.
No, they've got to be having an impact on us.
They absolutely impact the body.
Okay, now tell us some things, doctor, that could lead to it. Do they ever come in, do patients ever come in and after your half hour you realize, I think it's stress? I mean, sometimes you don't have to come in and say, I've had a divorce, which would pretty much clearly tell you this could be,
there could be something else
there
going
could be
on
a
out there.
problem. Yeah. But if they just, as you evaluate them, then do you see it could be a stress that's hurting them, that is they're complaining about?
Yeah, I mean, go ahead.
Yeah, I mean, it could be a headache. They come in and say, oh my God, I've got terrible migraines. Well, that's the symptom, right?
Right.
But that's not the cause.
Exactly.
Okay, so.
And so if all I do, if I give you a medicine, let's say some Imitrex to treat your migraines, I'm treating your symptom. I'm not really trying to get into what's going on with you. And if you're only able to spend a few minutes with that patient, that's really all you have time to do.
Right.
And so that's kind of what led me into this model, was to try to actually have the time to talk with people and figure out what was really going on. You know?
But you are a real MD.
Yeah. Oh, yeah.
I mean, you are a medical doctor.
I am a medical doctor.
You could have chose this model or any model because you are a MD.
Absolutely.
Okay, this is great to know.
I went to med school at Wright State in Dayton, Ohio. And then I went to residency here in St. Elizabeth, and I graduated residency in 2002. So I've been in practice 16 years now. And
wow.
Yeah, so I've worked in private practice. I've done urgent care work. I've spent most of my career working in community health centers over on the Ohio side of the river.
That's good to know. That's good to know.
So.
Okay, we have somebody with a model but yet, you know, she's been a lot of different I love this model.
Yeah,
I love that you take the time. I like that you chose to be different, to step out there and say, I'm going to do something different.
Thank you.
Okay, tell us some symptoms. So if people out there are thinking, you know, I'm having migraines, give us some things that stress can do to us that manifest physically, but you know underlying there's a stressful problem, possibly.
Okay. Well, there are a lot of different a lot of different symptoms that people, you know, can have. So yes, absolutely, the headaches can be some of them. Sometimes people can feel a short of breath or a tightness in their chest. That's important to realize, though, that there are a lot of other medical problems that can cause those same symptoms. So it's really important to find a physician that you can talk with to make sure that you're not missing something like asthma or heart disease and not just saying that it's stress. Okay, but so chest tightness, back pain. A lot of times people can have stomach issues like diarrhea, constipation. There's irritable bowel, for example, is something that can definitely be exacerbated with stress.
Would you say that our weakness, because many of us have inherent weaknesses, the stress would show up in a weakened part of us?
I think people tend to manifest stress in similar places over time. I mean, some people tend to get headaches. You might have stomach issues. Yeah. So
I understand.
I mean, some people have it in lots of different spheres, but.
Now, when I was younger, I had jaw pain from grinding my teeth.
Absolutely.
And clenching. And it was during the period where I was very uptight, and, you know, we don't have to go into the background of all that.
Of course.
But they could hear, you know, it was a terrible problem because it was wearing away on my enamel. Now, some people wear the guard and the whole thing. I did get quieted down once, you know, they knew why I was grinding. I think I took some medicine or something, some kind of medicine for a while too, and then I got over it. But I know that was a symptom because I was in a really stressful part of my life. So it can just be many things. That's why you like that half hour to try, because also we got headaches. We could have a brain tumor, for God's sake. So you have to take a while to understand if everything else is okay in your life and you know, terrible headache, it may not be stress.
And you also look for kind of alarm symptoms, things that when you hear, you're like, okay, wait, we're missing something. This is not stress related. This is, we really need to dig deeper and physically make sure there's nothing else going on.
Okay, I understand. Doctor, what do most people is there a basic thing that you see most people about? One, sleeplessness, Many people have trouble
A
sleeping.
lot of people have problems sleeping. People may have problems in terms of concentrating. May have problems feeling tired a lot. Sometimes it's just this vague feeling that something's just not quite right. You know, sometimes it's hard for them to put a finger on it.
And so this is why you love that half hour with them.
Because you have to touch on a lot of different components.
Okay, doctor, so now we've identified some of these things, insomnia, lower libido, stomach aches, many, many different things. Tension headaches can go into migraines, hair loss.
Yeah.
I was surprised about that hair loss.
Absolutely.
That some people start losing their hair and they've lost all their hair.
That would be pretty extreme. It's more common to be a slight thinning, but yes, your body does react in many different ways.
Wow. Okay, so now I know, in your practice, are you going to try a alternative before you reach for medicine? Or not necessarily, or?
It really depends on where the person is at. You know, I mean, it depends on what they've tried before. So there are a lot of different things, and sometimes we do more than one thing at a time. You know, sometimes it's talking with people about different lifestyle changes they could have, whether it's, you know, sleep hygiene, you know, caffeine. You know, if you're downing a lot of caffeine because you're not sleeping, then you're not sleeping because you have all the caffeine on board, and then that's also increasing the muscle tension. So talking with people about some things like that. I mean, exercise is really good, but right before you go to bed, not so good.
Yeah, because that revs you up.
That revs you up. That'll keep you going.
Sure.
Sometimes people will try something that is a supplement as far as initially. You know, there's some people that will use things like, you know, valerian or melatonin initially to try to help with some of the symptoms. Some people will use like meditation to start. There's a really great app out there that I like.
I want you to talk about that. Tell them about, is it Mindspace?
Headspace.
Headspace,
Very
sorry.
close.
Okay, tell us about
that.
that.
It's Headspace, and it's a free app. There are some paid things you can get to go along with it, but it's a free app, and you can download it. It has a session, initially like 10 sessions that you can do free, and you can set them for like 3, 5, or 10 minutes, and you can just do that yourself at home in a chair, and it helps. I mean, it helps the brain waves regulate.
I know people that really swear by it.
Yeah.
I mean, a lot of people think meditation and Headspace and that is and it isn't. It's mindfulness, staying. That it was huge for me because I would always be projecting. My mind would always be racing.
Right.
And when I could really come back and take the breath and think, stay in this moment.
Yeah.
Stay here. You can't do all of this.
No.
You know, stay here. So yeah, I think a lot of us have struggled with different through different periods of our life, you know, with different symptoms that come up from too much.
Yes.
Just too much.
So that kind of goes also the too much. I mean, too much can be too much good, happy things, and just too much. Too much can be, you know, things that people think of as stress things or bad things. So I mean, if you have a child that's getting married next weekend or is going off to college, I mean, all those things are wonderful things and they're normal things, but they can still be stressful.
Yes. Oh, yes. Okay, now, Doctor, let's see. I want you to talk about, because I think this is so important. This has helped me sleep.
Okay.
The breath. I think it's Andrew Weil.
Yes.
And his, you tell us.
Well, he has if you guys want to go online, you can like search him. He's got a bunch of videos.
But it's very,
about this.
it's true. It's very good, and I know you recommend it.
I do. I mean, it's a series of breaths, and you like breathe in, and then you hold it, and then you breathe out, and you do that a series of times, a couple times a day, and then that can help in terms of with the relaxation.
And it's 4, 7, 8.
Yes.
We're going to let it all out.
Yes. So you
take in for 4, hold
for 7, and then breathe out. And when you breathe out, it's a kind of forced slow exhale, like a.
Yeah, and I know, and you're doing this, and our tongue is up on the roof of our mouth.
Yeah.
And I know it sounds.
You might feel silly doing it, but it does
help.
It does help.
It really does help. And they say, and he says, if you do this a few times a day, it can just help you maintain to, stay steady
Yes.
and not get stressful.
Yeah.
So,
I mean, and if you think about that, people a lot of times will say, I don't have time. Well, you're breathing anyways. And
very good.
a series
hopefully.
Hopefully, you better be breathing otherwise. That's
Yeah.
a whole other issue if you don't.
Yeah.
But I mean, if you're doing these breathing series like 4 times twice a day, that's not very much time.
Not
if you're doing
really.
it 8 minutes twice a day, that's very little time.
Out of the whole day.
I know the headspace. I mean, there's a 3-minute option.
Great.
3 minutes. Most of us can find 3 minutes if we want to find 3 minutes.
If you really want help.
to.
And you've got to try these things.
Absolutely.
These things seem too simple to work, but sometimes simplicity's best.
Yeah, and not just try once. Try
that's
for a
true.
period of time.
Yeah,
Because sometimes people say, well, I meditated. Okay, one time.
And nothing happened.
It didn't fix
and
you.
nothing happened.
Exactly.
Yeah, I've tried that. Nothing works.
Exactly.
But really being quiet, just quiet, really helps in this busy world.
Yeah.
Okay, so doctor, anything else? We're starting to get here towards the end of the show. I want you to tell us anything that you think's important or anything I've missed that you want to. Well, really, I do. I want you to. Anything you can think of.
Well, I guess just the first step is to be aware, that you are dealing with stress, and to forgive yourself for that. Recognize it's okay, and you're not alone.
Isn't that the truth?
So that's one thing. And then when you try some of these things that we've talked about, the breathing, meditation, exercise, those sorts of things, if you're still having problems, reach out. Whether it's to your physician, to a counselor, to a minister, to a girlfriend,
doctor, because
you're not alone.
You said that. Don't be ashamed to reach out and say.
Yes.
See, a lot of people, I guess, are hung up about that.
Yeah.
Me, I want to get well so bad, I'll come and lay my heart out to anybody that'll listen. But there's a lot of people that aren't that way.
Yeah, there are a lot of people that are embarrassed or ashamed that they're having problems dealing with stuff. And everybody struggles sometimes.
Everybody does. We're all human.
Absolutely.
Anything else you can think of? Talk just a sec. Gratitude ritual.
Oh,
I think that's important.
Yeah. So sometimes if people are stressed, and they can kind of fall into a pattern of negative thinking. Okay. And sometimes if people take time to recognize all that is good in their life and all that they've been blessed with,
so good,
then that makes it easier to change the way that you're thinking. So sometimes people, if they keep a gratitude journal, and would they just write down the good things that they have going on, the things that they're thankful for, even if it's
little things,
little things. I'm glad I have clean clothes in my closet.
Glad we have heat. It's cold outside.
Exactly.
Right. Things that we take for granted are really big deals, especially if you're not living in the United States. So, well, Dr. Cynthia, you've been listening to Dr. Cynthia Villacis. Her information will follow if you'd like to contact her. And you have truly opened our eyes today. You've been such a... you could just tell that when you would go to her office, it's just going to be her. She's just so down to earth, so easy to talk to. I've really enjoyed the show with you today, Dr. Cynthia, and I hope you learned a lot too. As always, you be happy and you keep smiling, and I'll see you soon.
Thank you.